Hello friends, if you are young, less than 25 and you are losing hair, and if you are concerned about it and considering hair transplant as an option, you must watch this video till end. I am your friend Dr. Shail Gupta from Satya Clinic, and through our videos we discuss different aspects of hair transplantation. Now, as a young person, when you start losing hair, it becomes very embarrassing. People tend to lose their confidence, they minimize their social outings, and the emotional aspects associated with hair loss, especially at young age, makes you very vulnerable to misguidance regarding hair restoration. So most of the patients which I am dealing these days are repair hair transplants, and unfortunately lots of them are very young, and even at less than 25 years of age they had undergone hair restoration twice or thrice. When I counsel these patients, I realize what the real problem could have been. So when you lose hair at a very young age, you must consult a good dermatologist to find out the cause of hair loss. And most of the times it is androgenetic alopecia, but there are many contributory factors. It could be your genes, it could be diet, it could be some kind of stress, it could be some other disease also. So once diagnosed, medical treatment is really important. A lot of people think that hair restoration is the end solution, and once they get it done, there is no need to do anything else. That's a misconception. In my previous videos, I have discussed this point in detail. So, medical treatment must be given the first try, and you should try to hold on to your existing hair. You must try to sustain those hair, and that's really very important. Medical treatments help in this. Sometimes there is a treatment called PRP that also helps, but you need a proper guidance. As far as hair restoration is concerned, at a young age you are very enthusiastic about hair restoration. You have good donor and small recession from the sides. You might think of getting the hairline too low, and that's not a good idea because it will consume a lot of grafts. Your donor is limited. As you grow up, the hairline is fixed. It will look very unnatural, and the costing also increases. I always prefer making very conservative hairlines, and this is really important. The second aspect which you must understand is the method which you choose. Now, if you have a high grade of baldness, then obviously it is a combination of FUT and FUE. But if you have low grade of baldness, you can either choose FUE or FUT because your donor allows to do so. Suppose your graft requirement is around 2000 grafts, which can be done by FUE also, FUT also. Which method should you choose? So if you look at this video, there are two cases. In one case we did close to 3800 grafts by FUT method, and the other case we did just 2000 grafts by FUE method. Before the surgery, the donor area was kind of similar in both the patients, but now as you can see, in FUT there is a very thin fine line. That's because of trichophytic closure. The donor area above and below the line remains intact, which we can use later on if required. On the other hand, if you look at the FUE donor, it is depleted. There are a lot of gaps. It doesn't look good. For just 2000 grafts, this is the condition of your donor. Now, in case you lose your hair later on, the non-transplanted existing hair, or if there is thinning, you might need another transplant. And obviously, you will look at the donor, but the donor is depleted. If you try to take out FUE from the same donor zone, then that's a big problem, as you can see in this animation. Because of the scarring, the angles of hair, remaining hair change, and that leads to very high unacceptable graft wastage rate. So if you look at this patient, young chap, he has undergone FUE hair transplant somewhere else twice. You can see the hairline doesn't look good, it looks very unnatural. His density was excellent, as you can see the hair in the middle. Look at the donor now, it is devastated. So this is what I want to warn you against. Because of commercialization of things, you might not get the correct perspective. It is really difficult these days to expect all the clinics to tell you the truth. Satya stands for truth. Satya means truth. So my aim of making this video is just to make you aware. You learn from the mistakes which other people have made. If you like the video, please press the like button. You can also subscribe the channel. You can follow me on Facebook and Twitter. There is another channel on YouTube where we talk about life, where we talk about subconscious mind, healing, music, everything. The link is given here. You can see the videos, they are really helpful, and let me know your feedback. Thank you, love yourself, stay best.